Hey guys, it's me, Dr. Cameron Dennis, physical therapist with Back on Track Therapy and Wellness. And I wanted to talk a little bit today about Achilles tendinitis or Achilles tendinopathy. And basically what that is you're going to have, how it presents, I should say, is that you're going to have pain probably in the back of your leg right here. Okay, so it might go down into that heel bone there. That's called the calcaneus there. And then you have this tendon here, and it feels like a band. Okay, and that'll come up here into the calf. Okay, that big sort of meaty area right there. That's called your Achilles tendon. And basically that goes into your gastroc, your soleus, and also the plantaris. So smaller muscle in there as well. But basically what they do is they pull up this way, they contract, pulling on that tendon, which causes your foot to go point down, okay? Now, many of you already know this, but this is something that can become irritated in runners because of the repetition or because of trying to progress too quickly. So oftentimes with running injuries, it is not because of the way that you're running, but it's actually because of your training program. So maybe you went from doing not a whole lot to running 5 miles in only a couple of weeks or maybe a couple of days. And it really, the number isn't what's important, it's how your body responds to it is what's the most important thing. And so what we want to do in situations like this, because what we find is that there are different types of tendinitis, which is actually more appropriately called tendinopathy, because we find that it's not really, it doesn't respond in the same way as typical inflammatory conditions. So taking ibuprofen, it might help with the pain, but it's not necessarily going to reduce inflammation, because with the tendinitis or tendinopathy of the Achilles tendon, we find that it's within the cellular makeup itself. It's actually just more interstitial fluid, and the cells themselves of the tendon aren't able to elongate and compress in the way that they're needing to do for each step, especially with that when you're running. Okay, so they need to be able to accept force and then propel that force, sort of like a spring. Okay, so if you're having pain with that, oftentimes because that tendon itself wasn't prepared to function in order, in the way that you needed it to travel the distance, or maybe it was the speed that you're going at, or the distance that you're going at, or the frequency, so maybe you ran too often. But oftentimes that's one of the biggest things we need to look at when dealing with Achilles tendinopathy in order to prevent it from reoccurring. So how do we get rid of this, right? So this can be something that's what we call degenerative, or it's something that we can call reactive. So reactive is going to be something that's more recent. It's new, it's fresh, it's just happened. Okay, maybe only a couple weeks or maybe even a couple days or hours old, you're having that soreness in there. So honestly, with a reactive tendon, what we can do is we can try to back off the intensity. Okay, so run fewer days, run less volume, but what we don't want to do is complete rest. Okay, so I want you to try a couple things. If it's just happened and it's bothering you, try to just do ankle up and down. Okay, so this is just passive range of motion. We're just doing circles. Sorry, this is active range of motion, but it's not going to be resisted. Okay, so I'm going up and down, and you might do this 3 or 4 times, 15 to 20 repetitions. You can do that throughout the day. You can go in and out. Okay, and you can also do circles. Okay, that just helps get the blood flowing, helps keep that tendon working properly. It might bring out some of that pain that you're having. So that's one thing that you can try. The other thing to say is when it's reactive, we don't want to do things to irritate it more. So stretching, I would not do stretching if it's just something that's new. So stretching the Achilles tendon is not necessarily going to help. However, we want to try to load it carefully at first. So starting with isometrics, which would basically be like standing on a step and then backing up so that only your heels are off of the step. So that's what an isometric would look like for the Achilles. Basically, you're contracting the muscle without actually moving it through a range of motion. Okay, so that's kind of where we start with something like this, and then we progress it to calf raises, or something you oftentimes see in therapy is strength training for the quad, the hamstring, the hips, to make sure everything else is strong while that's healing. But then you would slowly progress it to heavier weights, what we call slow and heavy reps. So you might want to get to the point eventually, this is down the road, and this is where it's nice to have a rehab specialist, such as a physical therapist, to help guide you through it, because they'll know exactly when to take you from stage 1, which is maybe the range of motion, to stage 2, which may be the isometrics, to stage 3, which is the strength training through the range of motion, to the eccentric or eccentric contractions, which would be like heel drops, to more plyometric exercise, which replicates running. Something like box jumps, for example, or slowly getting into like a walk to run program, as running is a plyometric activity itself. And nothing is better to train for running than running. So it's something that I recommend that you have somebody to guide you through this process. I wouldn't necessarily suggest taking it through yourself, as you don't really necessarily know, unless you've dealt with this before or you're a healthcare professional yourself. You don't really know when the tissue is ready to be moved on to the next stage. And that's where it's nice to have someone with a background in musculoskeletal conditions for that. So the biggest key takeaways, I think, are: do not stretch if it's bothering you. Okay. Try to do the range of motion exercise, the circles, like I talked about. Okay. Back off your training volume, your training intensity, and the frequency, at least until that starts to come down. Okay. What we want to see is that it's okay if it flares up a little bit, but if it bothers you after doing an exercise or an activity for 24 hours after it's done, you maybe did too much. Okay, so we want to keep that pain somewhere below 6 out of 10 on the pain scale, if possible. And we want that pain to come back down to its sort of baseline, to where it was before you did that exercise or that activity. So that's sort of a couple good rules of thumb. If you have any questions, please feel free to reach out. If you live in the Wapak or Lima area of Ohio, come and see me or give us a call, and we should be able to help you out, get back to running. So thank you for watching. Once again, this is Dr. Cameron Dennis, physical therapist with Back on Track Therapy and Wellness in Wapakoneta and Lima. Thanks for watching.